As you know, this is 30 frames a second, and yesterday was the deadline for the Affordable Care Act. And it is my distinct privilege to have with me Dr. Don Dayson. Now, he's been practicing medicine in Harlem since 1979, I think he said. And we're going to pick his brain. He's going to give us some information about a lot of things that concern us and concern our community. And hopefully we'll answer some of your questions, or at least put you on the right path to getting answers to your own questions and finding out who to call, where to go to fine-tune the Affordable Health Care Act to make it more affordable and more conducive to the needs of people in America, and especially in our community in New York City. We're on. Into the fact where the victim is now the perpetrator and the perpetrator is now the victim. And that just drives me crazy. Okay, and we're back. Okay, and that looks pretty good. They got it going on now. We had a glitch or two. Dr. Donald Dayson, Don Dayson. Are you a Don or a Donald? You're a Don. Okay, Dr. Don Dayson. We brought you in here to clarify a lot of issues that we have, a lot of confusion that people have about the Affordable Care Act. The first thing I want to ask you is there a difference between health care and health insurance? And if so, what is the difference?
Okay, I'm glad that you asked that question, because I want to say that the Affordable Health Care Act is the first step. We have to ask ourselves, what is the next step? Okay, it's a compromise. Okay, when we think about health care, we need to ask ourselves three questions. What is universal health care? Second question is, what is the difference between health care and health insurance? And the third question, do we want our tax dollars to go towards paying for health care? Do we want our tax dollars to go towards paying for health insurance? Universal health care is that when you get ill, you can go to a health provider and taken care of, irregardless of your race, color, creed, nationality, whatever your background. You can get taken care of. And you don't have to worry about that. You can make the decision, I'm ill, I need to have my health taken care of. Now, health care.
Now, when you say you can get taken care of, do you mean you can get taken care of irrespective of whether or not you can afford it or not?
Yes, that's what universal health care is, or should be.
Okay.
Health care is what I just said, being taken care of because you're ill. Health insurance is access, it's the way that the health providers get paid.
Okay.
The
health providers meaning insurance companies or
doctors,
hospital corporations?
nurses, doctors, nurses, hospitals, respiratory therapists, blood labs, X-ray tech. Those are the people who provide the actual health care. Health insurance is just a middle person, a middleman between you and health care. The Affordable Health Care Act is an insurance bill. It's not a health bill. And the third question we need to ask ourselves and be clear about, do we want our tax dollars to go towards paying for health care, or do we want our tax dollars to go towards paying for health insurance? I want to just, before we get further into our conversation, I want to let you know about, there's a bill in the State Assembly and a bill in the State Senate called New York Health. New York Health is sponsored by Richard Gottfried.
He's an assembly person?
He's an assembly person. That's Assembly Bill 5389. And in the State Senate, it's Senator Bill Perkins. His bill is Senate Bill 2078. Under New York Health, we would be providing health care regardless of age, income, wealth, employment, or any other status. There will be no payment, no premiums, no deductibles, no co-payments. You would pick your primary care provider, and he or she would be the person to help you access health care.
Now, say that again. There'd be no
premiums, no co-payments, no deductibles. You walk in with your card to show your doctor, your provider, that this is who you are, and this is how you want to access health care. Okay? It's built on the model of Medicare. Medicare is the insurance for people who are over 65. Okay? Under New York's health, there would be we would get rid of all insurances. There would be no other insurance other than New York Health.
You said State Senator Perkins and Assemblyperson Gottfried are proposing this bill. Who are they proposing it to?
It's in the state assembly. It's in the state senate right now. Gottfried it was also in the last session, legislative session. Gottfried got 74 of the which is what is needed to be passed. Silver needs to just say that's what he wants.
Does the governor need...
and this is what we need to talk about that.
Okay.
And Senator Perkins, State Senator Perkins, got 19 of the 32 people.
Okay, so they both got a majority of...
No, we don't have the majority in the Senate. We need Cuomo to pressure senators, state senators, to push for this. And we also need Cuomo to come on board. Because what we're talking about is removing the health insurance industry out of the state of New York and replacing it with Medicare for all. There's a bill in Congress sponsored by Congressman John Conyers, House Bill 676, and there's a bill in the Senate, U.S. Senate, that is a single payer, a Medicare for all bill. Built in the same way. And how would it be funded? The same way Medicare is being funded right now. If you look at your stub, a payroll stub, there's your FICA, that's Social Security, and then there's Medicare tax. If you increase that Medicare tax by 1% nationally, and the state bill is even more progressive than that bill, you would collect enough money to pay for all the health care. And how could it be paid for? Medicare administrative costs, that's the paper that has to be pushed in order for the provider to get paid. Only is 2%. The administrative costs for private insurance, now under the Affordable Health Care Act, is 20%. 2% for the federal government.
Provider, who is the health provider?
Again, that's the doctors,
okay,
that's the nurses, the hospitals, the medical people, the people who actually do the touching of you, the people who actually say, this is what you need to do, and they'll be taking care of you.
Right. Okay.
And the pharmacists too. Okay. The administrative cost for private insurances is 20% under the Affordable Health Care Act. Before the Affordable Health Care Act, it used to be, it could go up as 40%. Another term for administrative costs for private industry is profit.
Okay, wait a minute, hold up. I don't want that to just like slide by. You're saying that the administrative costs under the Affordable Care Act, when done by the government, is 2%?
No.
Okay, break it down.
Medicare, which is a program that exists now for people who are bald-headed like me and over 65, that only costs 2%.
That's some bald-headed people at 25.
Okay. But it's only 2%. The other 98% of the money that Medicare shells out goes to us paying for the doctors, the nurses, the hospitals,
So Medicare, the administrative cost for Medicare, the program that is for the elderly, people over 65.
A federal program.
The federal program is 2%.
2%.
Whereas the private industry has administrative costs that are up to 20% now and were as high as 40%.
Yes.
That's the paper pushing cost.
That's the paper pushing cost.
Okay.
And part of the paper pushing cost for private industry is profit. The federal government doesn't have to make a profit. The first thing that an insurance company has to do is make a profit. The federal government has to make sure under Medicare that they have to monitor how providers are taking care of your health. Under private insurances, they have to monitor what's their bottom line, how are they making money. And the way they make money is putting a squeeze on you, the patient, and putting a squeeze on me, the provider. Okay, so do you really want that as your model? The Affordable Health Care Act, because it's a compromise, because we did not fight for a single payer. We, the people who work and live in the state of New York, who work and live in the state of the United States, we did not fight for a universal health care. We fought for my union, my tax bracket, my whatever. We did not fight for a universal health care.
So I think you said prior to us recording the TV show that we don't have single payer, but we don't have public option either. Is that correct?
No, we don't. Public option was a term that quote unquote progressives was fighting for and asking for single payer. That was what progressives was talking about, a single payer. House Bill 676 was the model for a single payer for the country as a whole. That bill was the first introduced in Congress in 1990 by John Conyers. That was the bill that the Clintons were supposed to support when they got into the presidency. That didn't happen, okay? So we have to still fight. The reason why I say the Affordable Health Care Act is a law of the land, now we've got to start to fight. Because insurance companies like that extra 20% that they got.
Right.
40% as opposed to 20%, that's a little bit of change that they want.
Right.
That doesn't necessarily go to us taking care of you or taking care of me. You the patient, me the provider. I'm a patient too sometimes. All right, okay? That's why that's my personal interest in affordable health care, in a single payer option. But the compromises under the Affordable Health Care Act, there would be no pre-existing conditions.
Right.
Before the Affordable Health Care Act, if you had some pre-existing condition, diabetes, high blood pressure, your premium would be jacked up higher. If you had cancer.
And in some cases, it would just be eliminated.
Or eliminated.
Right.
I have a herniated disc. After I got treatment for my herniated disc, my premium went up.
Right.
Okay. So they knock doctors too. All right. Okay. But that was one of the things that we got under the Affordable Health Care Act, which is a good thing. Another thing we got under the Affordable Health Care Act is there's no upper cap on your cost.
Right, right.
Unknowns to people, if you had cancer, for instance, and cancer is one of those things, or if you have renal failure, for instance, or if you have HIV/AIDS, for instance, your cost is going to go through the roof.
Right.
Okay.
The cap was $1 million.
$1 million.
$1 million. Right.
I've had patients of mine who, when they capped out $1 million for their cancer, they were told, well, I'm sorry, by the insurance company, but we can't pay for you anymore.
And this cap was germane not only to elderly people who it was germane across the board. So if you had a child who had some life-threatening, once they reached that cap, the kid was basically sink or swim.
Then you went to the federal government. Then you went to the federal government. The federal government was, you know, if you were eligible, you know, like I had a patient within the last 5 years who was working, who had breast cancer, a young woman in her 40s. She had breast cancer, and she capped out. And her hospital said, well, you know, they're the public hospitals. And so that's how she got to see me in the public hospital, you know. She was actually my private patient, but then she came to see me in the public hospital. Okay.
Also, I believe that I know of some people who found out they had cancer, and they were covered by their employer until the time they needed treatment, and then they were either terminated because they took too much time in being treated, or a number of things. Yeah, yeah.
Oh, listen, you know, if you like the insurance system as we have, don't worry about universal health care until you get sick.
Right.
And then you start to find out how we have a lot of mirrors in the private insurance industry. You know, like I said, my premiums were okay until I herniated my disc. Then my premiums went through the ceiling. Okay, if they do that to someone who knows something about insurance, a doctor, what are they going to do to you, who don't necessarily know about that? Okay, one of the other compromises that the Affordable Health Care Act did was that if your premium was too high, it will subsidize you, okay? And what are we talking about? If you're under 14, if you're a single person with just one dependent, yourself, and you made less than $14,000, you automatically got Medicare. They increased the Medicare threshold, so it covered more people. So like in Texas, for instance, there are like 2 million people like that. Texas would have 2 million people, 1.6 million people who automatically would have been eligible for Medicaid if Texas had accepted the Affordable Health Care Act. The other thing that affordable, and if you made less than $48,000, you got if you made more than $14,000 being a single person and less than $48,000, you would get subsidized by the federal government. If you signed up under the exchanges, like New York State Exchange, which was New York State of Health, or the federal government exchange, US Gov. Okay. If you signed up under the exchanges, a lot of people may have been contacted by insurance or insurance brokers.
Right.
And if you went under an insurance broker, you would not be eligible for the subsidy. You would have to pay the entire premium.
Right.
Like, you know, some of my patients who could not come see me anymore because they were laid off, and I'm no longer working in the public clinics I used to work in.
Right.
So they can't come see me. You know, they are making less than $48,000. You know, and one person told me like their premium was such that it was kind of expensive, but under the subsidy, they'd only have to pay $3. Their premium was going to be $300 straight up, but with the federal subsidy, they only have to pay $3 a month. Okay, and that subsidy is kind of nice. Okay, that subsidy is good. I don't take it away from anybody. You know.
I don't think people really appreciate how cost prohibitive healthcare was. Just the MRI could run you thousands of dollars.
Yeah, one of the benefits of Medicare as opposed to private insurance, Medicare, we'll talk to the radiologist and say, that $3,000 that you charge, we're only going to pay $800 for it.
Right.
Okay? Of course, the private radiologist would like the $3,000, and if your insurance is going to pay $3,000, that's good, you know. But it costs, I don't know what my radiologist actually costs, or MRI, what actually costs them. But they make out okay at $800. you know.
Right, right.
Okay,
right,
they make out
right,
okay.
right.
They make out better at
Yeah, some
3,000.
places in New York, just the MRI can run you as much as $5,000-$6,000.
Yeah, yeah.
And
where
that's
you go.
just like looking at you saying, oh, something is messed up there. You know, it's not even like treatment. It's just like the investigation of,
Yeah.
you know, it's a glorified super X-ray machine.
Yeah, but it's a beautiful X-ray machine.
I mean, it's a beautiful X-ray machine.
all right.
I'm not saying if you know, if you got the money, life is beautiful.
Yeah.
You know.
Okay. All right. So, but that's yeah. Healthcare is very expensive. Healthcare under the present system is very expensive. But the U.S., the amount of money that we spend for Medicare, Medicaid, and the VA is more money than any other industrial country spend for health care.
Wow.
Okay, my daughter was studying in Germany, and we were visiting her, and her mother slipped and fell down some stairs. We went to the ER. We saw the triage nurse. We saw the intake doctor. We saw the orthopod. We got the MRI. She didn't have a broken leg. She got her split in 3 hours. And it cost us zip.
Wow.
We're not German citizens. You know, I don't look German. I don't speak German.
Right.
You know, but the Germany has a universal healthcare system
Right.
paid for by the way they tax you as a citizen, me in as a citizen, and also in my office as a business person. You know, if everybody paid their share, you know, we could cover everybody in this country. There was a German company, the Diamond company. They bought Chrysler. At one point, they bought Chrysler because they said that when Clinton was coming in, that the U.S. was going to get their heads together about health care so we can come into the United States. You know, and then that Diamond Chrysler Canada made money. Diamond Chrysler U.S. did not make money. So after 10, 15 years, they pulled out because they thought they had a German model coming to the United States as far as health care. They were willing to pay the increased taxes to cover everybody. And that's what they did in Canada. And they made money in Canada. But in the United States, they did not.
You mentioned taxes, and I think one of the things that people don't fully appreciate is that you're going to pay taxes one way or the other. Most people see the taxes that are taken out of their paychecks or what their property taxes are or something that but there are taxes that you don't realize are being taken out. When people are not covered for health care, they tend to make the emergency room their health care provider. When companies like a lot of the minimum wage companies, the food industry, the fast food industry, big retailers like Walmart, a lot of their personnel are go to Medicaid to subsidize their health care. So although people argue about the Affordable Health Care Act and paying taxes and making sure that everyone has health care, irrespective of whether or not everybody has health care, everybody's going to get tax money taken out and an exorbitant amount of tax money taken out in the form of providing Medicaid for people who are working like fast food industries and you know, and it's not quality care, you know. So I mean, it's like pay me now, pay me later.
Yeah, essentially, because like you brought up the question about emergency room treatment. I used to work at Sydenham, the Renaissance Healthcare Network, which was what Harlem Primary Care Network was. Harlem Hospital at one point had the largest primary care network in the country, you know, and then they pushed it off to the Renaissance Healthcare Network. So I see a lot of folks who are McDonald's workers, you know, I shouldn't have said that, but in fast food
Well,
workers.
no, I mean,
okay,
McDonald's knows.
All right, okay, all right, sure.
This is not a secret to me. I'm sure it's not a secret to McDonald's, and
Okay.
but not just McDonald's.
Okay.
McDonald's,
like you mentioned,
Kentucky Fried, all of them.
Yeah.
You know, all of those minimum wage jobs, or barely minimum, or a little over minimum wage jobs. Many, if not most of them, don't provide health care in any form or fashion. That means that the people who work for them are below poverty, and they have no health care. There's only one option for them, and that's emergency room and Medicaid and that sort of thing.
Yeah. You know, like we have people going to emergency rooms in city hospitals because the city hospitals still have the mandate to treat you whether you have $1 or not. Okay,
Right.
and that's why they go there, you know. And they also go to emergency rooms at the so-called voluntary hospitals, but the voluntary hospitals get their money, again, from the federal government for charity care.
Right,
Okay,
right.
you know,
And the emergency rooms are like standing room only. Most of the appointment rooms, there's some seats you can sit down when you make an appointment, but when you go to the emergency room, it's like people everywhere.
No, because I'm off today and I got to get in to get my blood pressure medication.
Right.
I'm off today and got to get my diabetic medication. I have not had diabetes. I have not had my blood work for the last year because they don't do blood work in the emergency room anymore for diabetes.
Right.
You know, so you're getting your medication. You don't know what level your sugar is at. You know, you're getting your pressure medication. Rather than getting your pressure taken in the emergency room, you don't know what level your pressure is at. And untreated diabetes, untreated hypertension give you strokes, heart disease, kidney failure, amputations. You know, so penny wise and pound foolish is what this healthcare system is based on. Okay.
Now, I'm glad you mentioned that because heretofore, we've been talking about if something is wrong with you, if you get a life-threatening illness or whatever, but there are benefits to being able to have preventative care, being able to go into a doctor and see what you have to worry about, if you have to alter your diet before the guillotine comes down and you are forced into you know, a live or die, fight or flight scenario with your health care. How does the Affordable Health Care Act?
The Affordable Health Care Act has some preventive care built in. You know, like mammograms are paid for, and you don't have to pay co-payments for your mammogram. Colonoscopies, looking for colon cancer. If you catch colon cancer or breast cancer on a mammogram or colonoscopy, you can have a 20-year cancer-free period.
Wow. And those are big because
it's a big period.
Right, and and both of those cancers affect a lot of people.
Yeah, prostate cancer screening is paid for. There are a lot of big hullabaloo about birth control. You know, if you're going to pay for Viagra,
right,
shouldn't you pay for birth control?
Right.
I mean, that's a question that's being argued back and forth in the Supreme Court now. That's the reason why we need to say we need to fight, keep fighting, because the forces,
and that's
the conservative
based on some
forces,
strange religious, or at least that's what they say.
That's what they say. They don't want to pay for birth control.
Right.
They don't want women's health to be paid for.
Right.
You know.
Right.
But I've had some patients of mine who, women who over the age of 35, decide to have babies. Okay.
Right.
That's quote unquote a high risk pregnancy.
Right.
That's sometimes before the Affordable Health Care Act, some patients of mine have had trouble getting insurance for childbirth. You know, you're 35, but now you want to have a child. Okay, it's a little bit more hectic than just having a child under 35.
Right, right.
But that's something under the Affordable Health Care Act that's covered.
And I was baptized and somewhat raised Catholic, but I can tell you point blank that not everybody can afford to just have babies like rabbits and whatnot. I know I couldn't. Now I have something, talk about new health care for employers, 5 or more workers. What is
Okay, most small businesses are under 5 workers. Under 5 workers, the employer does not have to provide health insurance. Over, actually, the Affordable Health Care Act does not require an employer to provide health care unless the employer has more than 50 workers.
Okay.
So between 5 and 50, you know, it's your call as an employer.
Right, right.
You know, if you want to employer provide health care for health insurance for your employees, you know, you can, and you will get subsidized by the government to do that.
So a lot
Okay.
of the rhetoric that had people believing that somehow the Affordable Health Care Act would decimate small businesses
It's false.
is false.
It's false. You know, that only about 5% of businesses in this country, small businesses in this country, have more than 50 employees. Anybody under 50 was not required. It's up to you. If you want to get more workers, employers might want to pay, say, I'll pay your health insurance, but you're going to get a handout from the government to help do that. Okay, but that's one of the weaknesses of the Affordable Health Care Act.
Okay.
Okay, where the money for the subsidy is going to come from? You ever heard of something called taxes?
Yeah, vaguely.
All right.
Yeah.
So that's why I'm going back
People
to.
mention that a bit.
That's why I'm going to go back to single payer. You know, if you have a single payer healthcare, but Medicare for all, in New York State, New York Health, which will use a Medicare for all model, 2% administrative costs, 20% administrative costs. That 18% difference
There's a lot.
is going to be paid for by your taxes,
Right, right.
by my taxes.
Right.
Okay, do you want, again, the last question I asked, do you want your taxes to go to us paying for health care for somebody or health insurance for somebody?
Right.
When you're talking about health insurance for somebody, that person still is going to have to face a deductible, is going to be facing co-payments, and also going to be facing other things that insurances pay for. Like that woman who's 35, some of my patients said that they got a rider, they paid for a rider to pay for their childbirth, and they found out that the childbirth, they're only going to pay for $3,000 out of the $7,000 they had vaginal delivery, and was going to pay for anything if they had cesarean section.
Wow.
But
wow.
you pay for the rider. And if you didn't read the small print, you wouldn't know that you're only going to get $3,000.
Now,
Child bearing is a natural thing. It's not a sickness. It's something that some people want to do.
but if my understanding is correct, there are some procedures that pay a heck of a lot more than other procedures. And a lot of times there are physicians and surgeons and doctors who will steer you into those types of things that get them paid a lot more. A C-section pays everybody a heck of a lot more than a regular vaginal pregnancy. As a result, there has been a skyrocketing in the number of C-sections that have been performed. If I'm correct in what I in what I researched.
Okay, one of the things that the Affordable Health Care Act wanted to do was to look at best practices, best quality practices, okay? And one of the things that under Conyers bill, under New York Health bill, will look at best clinical practices. I used to do something called peer review back in the 80s. A Medicare requirement, not a private insurance requirement, would look over a doctor's shoulder to see was that procedure indicated, you know. And if the procedure was not indicated, Medicare would say, give me back the money, you know. So Medicare would pay for the procedure, but they had up to 10 years afterwards to review whether or not that procedure was okay. You get paid this year, and 3 years down the pike, you got some doctor coming in and saying, Dr. Nate, you know, you had a C-section on this patient. You know, what were the indications of the C-section? And you had to be stone cold on what was the standard of care. Mm-hmm. What was the standard of care when you gave that C-section? Mm-hmm. And if you push the standard of care to the edge, say, I need a C-section, and here it is 3 years later, and Dr. Nate, you know, really, that patient did not need a C-section, you're going to have to give the money back.
Now, Dr. Dayson, you had, and I got another question, but you had some information for us on how we could assist State Senator Perkins and Assemblyperson Gottfried in pushing Medicare for all in New York. Okay. How do we?
You can call Governor Cuomo to say that you want him to support New York Health. That's Assembly Bill 5389. That's Gottfried's bill, and Perkins' bill, State Bill 2078, that you want him to support that, because New York Health would be a way of getting us single payer in New York State. You know, it'll be a step above the Affordable Health Care Act. What Cuomo did, and as some blue governors did, they provided excellent state exchange, which made navigating the 15,000 health insurance policies that was out there easier for people. Okay, if you were not in a state that where the governor chose to help Affordable Health Care Act get launched, imagine picking through 15,000 policies. Okay, you know, the question about quality. You know, under a single payer healthcare system, you know, doctors are always being monitored by somebody. Medicare has the best quality assurance program. Private insurances say they do, but they don't really. They don't care what you do, as long as you get the people in so that they can make some money, you know. And they will pay you. What you were talking about is fee-for-service. Mm-hmm. A single-payer healthcare system is going to try and move away from fee-for-service and more towards quality care. There's something called the medical home, where groups of doctors, hospitals will be paid for the outcome. If you're a diabetic, how you're treating your diabetics. The federal government will give you X number of dollars for treating your diabetics. If you treat your diabetics so they don't have their heart attacks, strokes, or amputations, or kidney disease, you save money.
Right.
If you don't, you have to take care of them.
Right,
okay?
Right.
So the emphasis on prevention as opposed to I make more money off of amputations, I make more money off of cardiac catheterization.
Right.
You know.
Right.
But if I stop my patient from developing that heart disease, that kidney disease, that amputation, that stroke, then, you know, I got a better care. So patients will start seeing doctors pushing them more, because if you have a non-compliant patient, well, I've asked you to do this 3 times, you know. maybe you might want to see another doctor.
Now, in places like Harlem, and I think you said you were from South Carolina.
Yeah. Charleston, South Carolina.
Yeah, wow. But just in places like Harlem, where you have a large African American community, and I think the median income for the African American community in Harlem is like $15,000 a year.
Yes.
Does the wow. I think 133% of the minimum wage with one dependent is $19,000.
Yeah.
So a large percentage of Harlemites will be eligible for Medicaid.
Yes.
Are they benefited by the Affordable Health Care Plan? Is there something that they did not get, or is it easier for them to sign up for Medicaid? What is?
It's easy.
Okay.
It'll be easier for them to get into a program, either Medicaid or Affordable Health Care Act. Some hospitals probably might want to deal with private insurances because they will pay a little bit more than Medicaid. Medicaid, just like Medicare, are more rigorous in looking at the quality of care that you get. Surprise,
so there
surprise,
are
surprise.
hospitals that will reject you because you have Medicaid?
Not anymore, because they're going to try and get you into a higher paying insurance.
Okay.
They have social workers who are going to work you into, you got Medicaid, you missed the deadline to yesterday. Okay, I'm going to sign you up because in November I'm going to get you into, because this will give us a little bit more money.
Wow.
That's the new game.
Wow.
That's the new game.
Now, when I went to the when I went to the website, when I tried to go to the website, well, a few things happened. I had to get a better computer because my tablet wasn't computer enough to get into the website, so I had to get a better computer or go to the library. There's all that stuff. But when I finally got into it, and not actually realizing that I needed to type in New York State Health, and I typed in Affordable Care Act.
Yeah.
When I typed in Affordable Health Care Act, New York State was like one of the last things that popped up. It was basically 1,000 insurance companies all trying to get me to, first of all, believe that they were that they represented the Affordable Care Act and that this was the place to go. Basically, you enter a realm. If you take the wrong move, you enter a realm where you can really get steered into something that is more problematic than no insurance at all in some cases.
Yeah. No. See, because the threat of the penalty makes you buy the insurance, and this year you would get their policy at a higher cost. Because without the subsidy, and insurances companies work like that. Let me grab the money I can right now, and next year let me come up with another hustle to make some money.
Wow.
And I'm using in gross terms like that because that's what they do.
Right.
Their bottom line is not to the patient, but their bottom line is to their investors. And their investors invest in insurance companies for them to make money. And one of the losses for insurance companies is your illness. One of the reasons why there was a big push to get young people, because face it, well-headed people are the people who need it.
Right.
To help. I'm over 66. And I'm going to hit the healthcare system. When I do hit it, I'm going to hit it hard. I'll have a heart attack, I'll have a stroke, I'll have my kidneys will drop out or something like that.
Right.
Hopefully not. I try to take care of myself, but you know, we're all going to hit something.
Right.
All right. But most young people, you know, they may be ill, but they're not going to eat up the money that an older person who's ill will eat up.
Right.
You know, unless they have a very catastrophic disease.
Right, right,
Okay.
right.
So the reason why there was a big push to get young people is that we want, instead of that money going to your tax dollars going towards Medicare for all, we want that tax dollars to go to our insurance coffers. Your tax dollars is going to go to taking care of somebody if you have a Medicare for all. Your tax dollars is going to a private insurance who will touch paying somebody's profit. And oh, by the way, you know, you got an illness, if you're an insurance guy, I'm going to make it hard for you to collect money to get for your either for you to get treated or for your doctor to get paid. You know.
Do we have a call? If we have a call, if a caller has a question, put the caller through. I'm sorry, I haven't been paying any attention to that. But if we have a caller with a question, just put the caller through, and I'll say hello. Hello, caller. How you doing?
Okay.
No, it's not coming through. So while they're working on that, hopefully we'll be able to get him through, he or she through before the end of the show, because they might have a question. You had a 800 number that people can call.
Okay. They can call for New York State of Health. They can call 855-355-5777. Or you can go on the website, newyorkstateofhealth.org.
Okay. Make sure that you, when you go to the website, when you look this up, go to New York State of Health. Don't go to any of the other insurance carriers. I think we had a snafu and lost the call. But don't go to any other carriers. Make sure you go to New York State of Health. And if you try to call us back, we'll try to get you in. We're having a little...
Okay, but I also like people to get into the fight. This is just the beginning of the fight. You know, you need to fight for a single payer, because all of the people who've lost some money...
Hello? Hi, caller. Yes, you're on the air. Can you hear me? Caller, can you hear me?
Okay, hello, Kareem from Harlem.
Hey, Kareem, how you doing, brother?
Woods and Dr. Dayson. I just want to say thank you, Dr. Dayson, for coming forward with this important issue, because it's really very important to our community. But what I want to ask you is this here. How important is it for us to explain to our people all these lies and deception by these Republicans and insurance providers who are trying to say that Obamacare is nothing, going to do anything but cause problems and cause, you know, different serious problems with people? How much of a lie, and what should we do to make our people understand that it's very important to get this Affordable Care Act, because these insurance companies only want to make a profit. I would like y'all to respond to that. Thank y'all for taking my comment.
Oh, thank you, brother.
Okay, again, the Affordable Health Care Act was a step. You know, it's the first time that this country says that everybody should have health care. And it provided a mechanism, an insurance mechanism, for people to get that health care. But that mechanism is, while the principle of universal health care, the country says we're supposed to have it. How we're going to get it is the fight that we need to participate in. Don't stop with affordable health care. Push for New York Health, and push your congressperson and your senator, your U.S. senator, to fight for single-payer health care. All along, we were sitting down and letting President Obama do this fight for health care, but we've not been calling our senators, our U.S. senators, our U.S. congressperson to say, we want single payer. Single payer is the only way that we're really going to get universal health care. Otherwise, we're going to have universal insurance that's going to cost us more money.
Now, the caller made a couple of valuable points. The caller alluded to the fact that there is a lot of misinformation that's going out as it relates to the Affordable Health Care Act. Some of it was just like weird, like, you know, oh, they're going to take away your doctor that loves you and give you like a witch doctor who's going to, you know, sprinkle tea leaves on you. That it's actually hurting people. They've also he also alluded to the fact that that he is respectful and grateful to people like you who will get on and talk about the Affordable Health Care Act. But you're not my politician. You're not, you know, and I appreciate the fact that you've taken time out of your busy schedule. You've come down to explain some things to our viewers. But I think a lot of the problem that we have with people not pushing for things like single payer and Medicare for all is the fact that many of our politicians have not been diligent in really getting out the information that we should push for this and we should help them. I think in some instances, some of our politicians seem to be playing both ends against the middle. And none of it is actually to our benefit, you know. Am I mistaken? Should our politicians be more diligent in saying, get your butt out there, that we need this push, support the Medicare bill in the State Senate and the Assembly? Or?
You know, what I would advocate to everyone that you call your state senator, your state assembly person, and said, give me some more information about New York Health, and call your congressperson and say you want them to support the federal bill, House Bill 676, or I won't vote for you. You know, some Congress people have been supporters of 676, and when they're in position to work for 676, they moved back. But if you say, this is a congressional race coming up, you know, push for 676. Say, call your congressperson. There's something called Vote Smart, 1-800-VOTE-SMART, and you can find out who your representatives are. You know, in Harlem, Perkins is our state senator, and Keith Wright is your assembly person.
Correct.
Okay, and you can call. Wright is a supporter. Perkins is a sponsor of New York Health. You know. But Perkins.
Those are our senators. You have we got another call. Let's take the call because we're running out of time, and I want to. Hi, caller. You're on. Hello. You're on. Just speak. We hear you. Hey, brother. How you doing? Hello.
Yeah, I just wanted to ask this. It seems like, as the caller said, that affordable health care is basically mired in like conspiratorial, like misinformation and whatnot, and so on and so forth. And it seems like even if the black community was to motivate and try and get their congressmen and representatives to do what they got to do, it seems like, is this true what they say about the Republicans getting taking over the Senate and so forth, so on and so forth, that they're going to actually repeal this thing anyway and whatnot? It's like, how does one supersede all of that? Because I've even heard that this is supposed to be, this is like a tax disguised as some kind of insurance thing or something like that. I'll let y'all got that.
All right. Thank you, caller.
Oh, thank you.
Yeah, I think it's too late for a repeal.
It's too late for a repeal, but so what they're going to try and do is to gum up the works even more. You know, there's a stupid Time magazine on March the 10th talked about what was done to try and get the federal exchange up, because the federal exchange was sabotaged. the person who was in charge resigned after the bad rollout of the federal exchange, and a week later he was working for as a chief IT officer for some large corporation. Now, if you screw up a major thing like the federal government program, and everybody knows it, who's going to hire you?
Right.
Unless you already had that job set up.
Right.
You know.
We only got like about a minute left. And I just want to say this because the caller mentioned that even if the black community rallies behind these bills and do what it has to do, there's a lot of misinformation out there. I just want to throw this in, and I'm going to give you a minute to wrap this up, but I just want to throw this out there, that a lot of the states, a lot of the red states that they talk about are welfare states. And they have a lot of poor, like almost starving redneck communities who desperately need health care and subsidies to their Medicaid, otherwise they cannot exist. And it seems, and it just goes beyond all logic, that a coal mining town like West Virginia would be against the Affordable Health Care Act, or a place like Alabama, or South Carolina, or Mississippi. That seems to go beyond all reason. But you got like a minute to wrap this up, and before we have to say goodbye. So.
All right. The NAACP in North Carolina and Georgia have these things called Moral Mondays. You know, they need money to help organize that Moral Mondays. You need to help them try to elect more Democrats in those states, and more Democrats to help keep the Senate. Enough people are going to, people in West Virginia, white people in West Virginia, are hiding signing up for the Affordable Health Care Act, because the Affordable Health Care Act is that Negro, and they're not using the word Negro,
right.
Insurance, but they know they need the insurance.
Right. Right.
And because the racists who are running the show in West Virginia have them cowed into saying, I need health care, so I have to hide getting health insurance so I can get health care.
We've got to go. Contact your state senator, contact your senators, contact your assembly people, push Medicare for all in New York City. Make sure that there is Medicaid for all, for everybody in the United States of America, because we have a lot of people who are unemployed and or starving in this country who need health care. We'll see you next week. Peace. We're out.
Okay.